Hello, I'm Dr. Georges Benjamin, the Executive Director of the American Public Health Association. Gun violence is in epidemic proportions in the United States, and is indeed a public health problem. With over 40,000 deaths each year and over 100,000 people who are simply injured from guns, it remains a critical public health problem. We know that it's also the leading cause of death of our kids, and it costs over $280 billion each and every year. And the tragedy is, much of it is preventable. Now, a public health approach to addressing firearm violence was proven many, many years ago when we began talking about making guns safer, making people safer with their guns, and making the environment safer for people and guns in it. This is the same strategy that we use in a very dramatic way to reduce the amount of death and disability from automobile crashes. We made cars safer, we made people safer with their cars, and we made the environment safer for people to drive their cars around and for us to walk around. So we know that this strategy works. So this is something we certainly ought to do to try to address gun violence. We also know that there's a host of policies that are evidence-based and have been proven to work. Those policies include extreme risk protection orders, the so-called red flag laws, stronger protections for victims of domestic violence. We know that we kill the ones we love. We know that licensing, making sure that people who should not have guns don't have guns, and of course are properly trained to use those firearms. Restricting assault weapons and large capacity magazines. That's going to be a big issue going forward. Addressing people that are in violent communities by addressing people who have been injured. When I was practicing emergency medicine, we often saw people who were injured in a fight. They come into the emergency department, we would patch them up, and then a few hours later they'd come back either shot or dead, or someone else was, because the fight wasn't over. So doing violence interruption in communities is another proven strategy in many of our urban settings to try to address that type of violence. And of course, reducing blight in urban communities, because there's a correlation between that in many of our communities. And of course, we absolutely need to do much more gun violence research. There's a lot of interventions that we know work, but there are a lot of things that have not been researched. And so dealing with this is going to be very important for this tragic, tragic public health epidemic that we have it each and every day in our communities. Thank you.